So I'm joined by some of the nurses that work in endoscopy to ask some follow-up questions about colonoscopies. So what are some common concerns that patients have about their procedure?
The most common concern is the exposure. They're not wanting their bottom shown. With that, we make sure that they stay covered until we do the procedure. They're always asleep before any of that. The prep itself can take a couple days with clear liquids and the prep, and you're in the bathroom quite a bit, so people are worried about that. A lot of people think that they're going to have pain. There's really not pain involved. Again, they're asleep through the procedure, and that's not a problem that we come across.
It's good information. So what can patients expect with the prep that they have to do for a colonoscopy?
Well, each physician has their own prep and their own instructions, but typically it's drinking a lot of fluid the day before and multiple times to the restroom. It's real important to drink lots of fluid the day before to prevent dehydration, and mainly just sticking to the instructions that the physician gives them.
Sure, thank you.
Yes.
Can you tell us a little bit more about the equipment that's used for a colonoscopy?
Well, we use a colonoscope for the colonoscopy. It's a tube that goes into the colon. We lubricate it before going through, so it's not uncomfortable for you. It's hooked into a light source, so it will shine a light, as you can see, and it will show the colon on the screen, and that's what we look at to look at the lining of the colon, to identify any unusual areas, polyps that you might have, and also assist us in if we need to remove those. We can see where they're at, so we can help to remove those. It does put some air in the colon to open the colon up, so we can take a look around better, because your normal anatomy is it just falls and moves on itself. If we don't put air in there, we open it up so we can see the lining of the colon. The colonoscopy itself maybe takes about 20 minutes, 30 minutes or so, and that just depends on what might be
Sure.
observed while we go through the colon.
Sure. Thank you.